Welcome to the Sit, Stay, Laugh podcast. My name is Dr. Adam Chrisman. I'm a general practitioner, and I'm also the Chief Veterinary Officer for DVM 360, which oversees continuing education for veterinary professionals.
And my name is Dr. Ashley Bourgeois, also known as the Derm Vet. I'm a board-certified veterinary dermatologist, passionate about educating veterinarians and pet owners about pet skin and ear disease. We are two veterinary besties who are intrigued with all things pets.
And we love to have a fun time laughing through life.
Come along with us for a fun ride.
Sit,
stay,
laugh.
Well, thank you everyone for our second episode 2 of Sit, Stay, Laugh podcast. I'm Ashley Bourgeois. I'm a boarded veterinary dermatologist. And then I have two of my favorite guys on, of course, one of my besties, my co-host, Dr. Adam Chrisman. Are you going to give a hey?
What's going on, everybody?
Oh, yeah, he's ready.
Let's do it.
Do it.
So excited for what we have, Ashley.
Yeah, tell me about this specimen of a man right here.
I know, everyone, I hope you're sitting down and your ears aren't going to break, but we have our wonderful friend and colleague, the Dr. Courtney Campbell, that's in the house. What? Put your paws together.
Was that the best introduction you've ever had?
Easily. I'm waiting for the crowd to go wild, but there's nobody going wild. Everybody's like, okay, next thing. Now, listen, this is amazing honor to be here, and it's something I've been looking forward to literally all month long. So I finally get a chance to talk with you two. And it's like the only thing that would make it better. The only thing that would make it better is if I was trapped in a booth, a podcast booth with all of you, but this is good enough.
Oh man, that would be trouble.
Yes.
Well, let's get a few episodes under our belt, gain some momentum before we start flying people out as me and Adam alone are on opposite sides of the country.
Yes.
But big dreams. We can dream big. We can dream
man,
big.
A guy can dream, man. A guy can dream. I don't think I've ever had a dream where I said, I got to be trapped in a podcast booth, but I'm going to make this come to a reality right now.
Add that to the bucket list.
Yeah. Well, and, we have all been friends for a really long time. And so we do know some of your story. And, we're really excited to have this conversation, and we couldn't think of anyone better to have on the podcast as we're kind of starting this process. But for our listeners, tell us a bit, we didn't even formally we are terrible hosts. We didn't even formally introduce him. Adam.
Well, I want him to tell the story. He's got to tell his story on who he is, where he is.
So this is board certified veterinary surgeon Courtney Campbell. We haven't even said the name. We are so amateur.
Oh my goodness. Listen, I mean, let's be honest. You are too sweet and too generous for saying that you couldn't have found anybody better. But let's be honest. You definitely could have found a lot of people better to be on the podcast. But you know what? You picked me. You got the short straw, and that's good. Yeah, my story, man, I think that's probably, it has to be hands down one of the most difficult questions to answer, where people might ask you, so tell me about yourself. You're like, all right, where in the world do I start? But I'll start in the woods. Anybody who's listening who grew up in the woods.
Into the woods.
That's where we're going to start. In the woods, yes. We're going to start in the woods. I grew up in Burlington, Connecticut. So Connecticut is...
Go Huskies,
yeah, I'd say
right? They just won.
Yes, go Huskies. Absolutely at the top of the list for the most boring state in the union, for sure. And so I would say that, being in the woods, man, I'll put it this way. The two words that you did not want to hear in my house were, I'm bored. Because if my mom heard that, I'm bored, you were in trouble. Go outside. There was wood to chop, leaves to rake, house chores, right? I mean, if you see pictures of me in Burlington, it's almost like I'm in a red plaid shirt. You know what I mean? I should be holding a roll of paper towels like the Black Brawny Man or something like that. It's just full on lumbersexual situation. So I think at the end of the day, that's where I sort of discovered my love for animals, just exploring the woods out there. And and then I was off to the races. I left home, tried to be a little bit independent, but I didn't want to be too independent. So I only went 4 hours away from home. I went to University of Delaware. That way, if I was, if I need to I really needed parents, I could go back home. Then after that, Tuskegee University in Alabama. So you've got this kid from Connecticut, right? I guess we're supposedly called nutmeggers. That's the nickname for people from Connecticut. You got this northeastern kid going down into the deep south of the United States to go to vet school. And then just basically the shenanigans ensue after that. So yeah, that's basically my story. But it's all started in the woods, So when people say started from the bottom, now we hear, I'm talking bottom with salamanders, skunk cabbage, swamps.
Yeah, you created those lyrics for sure. But to the listeners, though, because this is, I talk a lot about this to pet parents. How old were you when you knew you wanted to be a veterinarian?
I knew for sure that a veterinarian was on my top 3 list when I was in the 3rd grade. When I was in the 3rd grade, that's when I knew, that's when I knew that it was probably going to be on my top 10 list, my top 3 list. Now, as I started to get older, I had a top 3, and the top 3 by far was I wanted to either be a chef, a veterinarian, or a magician. One of those 3. And my parents.
Hold on. Those are wildly different. Those are wildly different.
I don't know. Are they really, Ash? I mean, if you
we are kind of magicians as veterinarians. Yes.
There you go. And shout out to all the chefs out there. You guys are a magician with food. So, and they all involve some aspect of, I guess, performance. But at the end of the day, my parents gently guided me away from the last one. Just ever so gently. I don't know if they just weren't, hey man, shout out to Chris Angel and all those guys out there. They're making a living, but I guess my parents just didn't see it the same way, And so I ultimately, I knew medicine was the key there. And I think you say, well, how did you decide veterinary medicine? And I honestly think if you have a passion for science and medicine, and then you just decide what sort of platform you want to work on, right? So if you like people, be a physician. If you like animals, be a veterinarian. If you like feet, be a podiatrist. But the love has to be, and I could keep going on, right, with specialties, but I think the love has to be with medicine and science first, and then you just decide what model you want to practice on.
Yeah, I mean, go ahead, Adam.
Oh no, I love that, because sometimes we always say it always just takes a moment, whether it's an interaction, an experience, a mentor when you're a kid, that really kind of creates that trajectory. And big shout out to the teachers out there that are listening, because you have such an impact on all of us in this world. And, and it's kind of nurturing that relationship. I know when I was in 4th grade, I knew I wanted to be a veterinarian, and having that science and those teachers that really kind of helped nurture those relationships and educational experiences for me were so huge with what I wanted to do. What was it like for you, Ash?
Yeah, so it's interesting. I didn't really have pets growing up. I grew up a daughter of an Air Force pilot, so we moved around a lot. So I had a cat when I was really young, and then we had a dog for a couple of years before he had to make a move that we couldn't take him on. So I actually didn't have a lot of pets, but I had that inert love for animals. And speaking of teachers, it was when I was in 5th grade that we had career day, and a veterinarian came, and it was just oh yeah, I love animals. Why wouldn't I could make that my job. And then it just completely took off from there. So I wasn't surrounded, so different. I wasn't really surrounded by animals, but I always gravitated if I saw them. So it is different. And speaking, of teachers and childhood dreams, my daughter right now, she just turned 7. And it's interesting because my husband's an engineer. I'm a veterinarian. She'll jump around being oh, I want to be a veterinarian engineer. And lately it's been astronaut, which I actually wanted to be an astronaut. That and archaeologist were the 2 things I wanted to be before I became a veterinarian directed. But it's been cool because I didn't want her to just be a vet because she knew mom was a vet. So if she comes back to it, she's got tons of time. That's great. But I love just seeing her interested in other things that she's learning at school. That's kind of her direct impact. But we do have to talk about something, Adam. We have to talk about something.
I know.
Okay.
Go ahead.
Tell us about your fur baby.
My my fur baby.
Just wait, because no
Well,
one's gonna guess what this
no.
is.
Oh man, everybody'll know. It's like the most, I mean, it's probably the most expected fur baby for anybody to have. She came to me during the quarantine of COVID. Her name is Quarantina. She's a lovely hamster. And this hamster, I tell you what, she's inspirational because if you don't feel like working out late at night, you'll see Quarantina working out at 2 or 3 in the morning, and you'll say, okay, I got to get moving because homegirl is up at 11, ready to go. And when she gets up, when she wakes up, there's always something to do. It's almost like she has I don't know if you're into like checklists and like to-do lists and stuff like that. But when she wakes up, I mean, homegirl has, she's got stuff to do. She's got food to put over here in her pantry. She's got this to clean up. It's amazing watching her constantly on the move, working.
Sounds like a stereotypical woman. Always on. You're like, she always got things to do. I'm like, my husband would say the same thing about me.
My gosh, I love that though. And again, it just goes to show you it could be no animals too big or too little to love the human race. I think that's so cute that you love a little Quarantina. So okay, so you're a board certified veterinary orthopedic surgeon. So to the pet parents out there, that's awesome. So tell everybody a little bit about like the day in the life of an orthopedic surgeon. What does that look like?
So this is what's really fascinating is on the human side, there has been this delineation within the surgery world. I'm a trauma surgeon, or I'm a spine surgeon, or I'm a soft tissue surgeon, or a cancer surgeon, or orthopedic surgeon. And those delineations, those separations are kind of a relatively recent addition to veterinary surgery, right? So when I went through my residency, I was trained on it all, essentially. Now, it's obviously hard to learn every different type of surgery, learn every different discipline of surgery. That's really challenging. And so, yeah, some residencies are going to have more of one versus the other. But generally speaking, when a veterinary surgeon comes out of their residency, they are essentially highly trained or specially trained in just all types of surgery. Now, as time goes on, you start to develop a little bit of interest, right? And one of the most common questions I get is, Courtney, what's your favorite surgery? And my answer is any procedure that goes well. That's my favorite one. No, I'm kidding. I do like orthopedics, of course, because there's a structural element to it. But the day in the life of a surgeon could involve a variety of different things, whether you're dealing with tumors or you're dealing with rerouting something inside the body, like the intestinal tract or the gallbladder. But then when it comes to orthopedics, torn ligaments, broken bones, dogs who were born with bones that were crooked or diagonally shaped, just your Heinz 57, like what? How did you come out like this? Those are really fascinating cases because here's the key. The one take home is mobility. That's the takeaway word right here is mobility. You can't put any of our species different family members in front of an iPad and just say, okay, that's going to be where you enjoy life right now. Their life is mobility. Their life is movement. And so if you can restore movement, it's not overstating it to say you're restoring their life. And that's really what I focus in on orthopedics is really just trying to get them families to enjoy life, for them to enjoy their own lives and do that through restoration of movement.
I think that's awesome that you even kind of put it in a basic context like that, right? So like for me as a dermatologist, we're often like itch. Like there's lots of things that feed into that. A huge part of us relieving that suffering, not just for the pet, but for the pet parent, because there's such a huge quality of life that affects when you have a human animal bond, but that you put it to that basic aspect of mobility, because you can think of, like you said, conformational defects that maybe are congenital. You can think of trauma, like they got hit by a car. You can think of what I would assume is probably one of the more typical surgeries that you would do, and that's a cruciate being torn. But just thinking of in that broad spectrum of mobility. Like, how do we help these pets in a way that they can actually move? And I'm going to guess, this is out of my realm, but, you as a general practitioner, you as a surgeon, that there's kind of different categories of things we can think about, right? There's medications that can be prescribed to provide relief. There's procedures that you as a surgeon can do. And then there's just the environmental changes that we have to consider. Adam, you have dachshunds. I mean, you have gone through, I know what you do, but you've had to go through some environmental changes, right? Like you have your ramp, you have the stairs, like different aspects that you have to think about just with their conformation being different, or if they do hurt a disc or anything like that. So if we kind of look at those three different categories, Dr. Campbell, medication wise, procedures, environmental, like what are the big things you'd want pet parents to know? Obviously, the whole end goal is mobility. But is it kind of always just going to be one or the other? Is there a marriage between those three categories? What do you feel like, let's say in a typical either recovering from a cruciate or osteoarthritic dog?
What's fascinating about this is that we all sort of have a bottom line or a basis of experience, right? We know there's so many internal medicine doctors out there who are treating liver disease and kidney disease, and arguably a lot of pet parents may not know the intricacies and the details of the liver or the kidneys. And from an immune standpoint, from allergy standpoint of the skin, that can also be very complicated, right, Ash? And Adam, obviously you break things down into like these amazing top 5 lists that really help people wrap their mind around a lot of concepts. But when it comes to mobility, we all move. We all try to move. We understand what movement is like, even if it's impaired, or even if it's smooth, or even if we were elite athletes. We all, from the entire spectrum, we get to an idea on what it means to be able to move. And so that comes into play a lot. It's, where you're talking with a pet parent and they may say, all right, you're trying to restore my dog's mobility, but in my experience, I took these medications and it helped me. Or I am more into more Eastern medicine or acupuncture and it helped me. Or, you know what? I had surgery on my shoulder and it feels so much better now that I had it. So there's so many families who are bringing in their own personal experiences to the treatment. Now, I will argue that certainly that's great, wonderful. But then there's some times where it definitely diverges, where if you're a biped and you walk on two legs, things are a little different when you're on 4 legs, right? Things are a little different when you're outside trying to, avoid predators, right? Things are different when you're trying to jump from the cat tree. So yes, I think it's wonderful to bring in that personal experience, but there are times in which it's divergent. So I will certainly say you're spot on. Environmental, medication, and by far surgery all can be used in conjunction with each other. In fact, we do that really frequently. And that's what I would always recommend in any type you have a situation that you're trying to treat, is see if you can put a check mark on all 3 of those buckets. What are we doing for the environment? What are we doing for medications? And then is there any surgical option that we could pursue to help them out?
You have a quote that you did in one of our TikTok videos that you and I did together, and it was called "No Crate, No Date," and right, you remember that? And
no crate, no date.
When we're talking about post-operative care, I mean, it's a fine line between movement and rest. I mean, we talk about crates, we talk about dog beds, we talk about making sure that they're resting, but also we want them to move. So what does that look like when you're going over these discharge instructions with some of these pet owners? You want them to do PT or physical therapy, but I'm curious to get your perspective. And then Ashley, I know that some of these dogs can also develop, like pressure sores or calluses. So what does that look like for you, Courtney? And then I'm curious to see what Ashley's take is on that as a dermatologist.
Thank you so much for bringing up that quote, because that is kind of interesting. I do use that quite often. What that phrase means, no crate, no date, what it really means, if you think about the basis of it, is essentially means we're a team. That's it. This can't go well if the only people who are focused on the outcome is the surgical team, right? They can do the best surgery they can, but if we go home and now you're jumping out of the truck, or you go home and you're sprinting around the couch with no carpet, you're slipping on these hardwood floors, then this whole team, this is not going to work out. So really what that phrase means is we are a team. We're focused on one goal, which is success, excellent surgical outcomes, excellent postoperative surgical outcomes. So if your pet is having surgery, for sure, and the pet parents, almost every surgery that I can think of is going to require some aspect of exercise restriction, some aspect of confinement, because as you know, our patients, a lot of times these things are happening in the prime of their life, and you're asking for the impossible. To take a dog who's in the prime of their life, who's accustomed to running around, or a cat who's accustomed to jumping all over the place, and you say, all right, now you got to be quiet for 6 weeks. They're like, wait, what? How is this supposed to happen? And so I do think it's so important for the family and the specialist care team to all be on the same page. So that's what that phrase really means, is it's all a team approach. And like you said, I'd love to know, Ash, like what you think of that whole team idea and team approach.
Yeah, let me first off say my previous dog tore her cruciate and we had to have surgery. So I can say, even as a veterinarian, I always empathize with the owners. Like, it really sucks. It does. Like, I think it's really important for us to recognize that. It's easy. And so same goes when I'm managing my derm patients. I always tell owners, this is a team thing. Like, I can write stuff on a piece of paper, but like, I understand you have to go home and do it. And we also have, and also if there is something that cannot be done, I have to know now, because I don't want to prescribe something that's not realistic for you. In dermatology, we're pretty lucky because we have we're very topical, product based. There's lots of options. We do procedures, obviously, like allergy testing, some mash removals, venomous insect testing. But a lot of ours is more like working into a treatment plan long term. But totally to your point, like, I tell them, like, you are the advocate at home. Like, if I give you a 6-month recheck and in 2 months they're not doing well, like, I have to know. Like, I don't know unless you tell me or you bring them back in. So I always say the team approach, as far as at home, if something changes, I need them back in to know. And if I'm putting forth a plan, I explain it to you, and in your head, you're already thinking, there's no way I cannot bathe my pet once a day. I cannot, allergy testing is not really my goal here. Like, I have to know, because we have other options, but I don't know unless I know. Going to the aspect of skin disease that Adam was asking about, we do see this in dogs that are recovering from surgery, and certainly cats, but we just think of large dogs, right? So I would say the typical things that we see are, wounds, which we usually work with the surgeons to kind of manage depending on the severity of the disease. If we have to culture, look for resistant bacteria. But also in some of the other things that we notice, like infected elbow calluses, I would say is a fairly common thing for me to see in some of my older arthritic dogs that maybe are managing pain with the surgeon, or they have in the past had surgeries, and maybe that's affected them to some degree with some of their joint degeneration. So when we talk about environmental aspects, because I'm clearly not doing any procedures for surgery, gross. I deal with the skin. I don't cut it open. And I'm very limited on my medication knowledge. I know some about NSAIDs, but not a lot. So I really can only think of the environmental aspects. And that would be coming down to things like, what type of grip do they have? So we see some dogs that get issues on their skin if they're like always laying on hard surfaces on one side, infected elbow calluses, hygromas, things like that. So definitely kind of noticing, where is your pet most of the time? If they like a certain area of the house they lay in, do they have a really good quality dog bed that they lie on that provides good support that they can get on, that's in an area they can get on? Because I've had situations where the dog loves being downstairs where there's hardwood floors. And then the owners will say, well, they have a really wonderful dog bed. I'm like, oh, okay, where is it? They're like, oh, upstairs in our room. I'm like, well, do they go upstairs? And they're like, oh, no, because they're painful. I'm like, well, let's bring the bed downstairs. So there's simple things that, when you're overwhelmed and you're going through a situation with your pet, when I bring my own dog to my GP, they'll say something that's so simple. And I'm like, oh, yes, tell me more. I should have thought of that. So sometimes it's simple changes to the environment that can really help the quality of life for the pet and the pet owner.
I couldn't agree more. It's a change in environment. And, Adam, I hope I'm not putting your business out in Front Street, but you and I have definitely had some challenges in lower back issues, right? And so I think that with pet parents, sometimes they bring in their personal experience and their biases with dealing with something that I've had, right? Some sciatica, back issues. And sometimes, and I've seen this more than once, their personal experience with comfort involves pillows, right? Lots of pillows, luxurious plush pillows. And it's like, oh, that's nothing more luxurious than getting on this nice pillow. If your dog or cat has recently had surgery, really have a conversation with your surgeon about whether or not pillows are appropriate. Because if I've just done surgery, particularly a knee reconstruction or a hip surgery, we don't want sort of this unstable, this very plush environment for them to step on because they feel so uncomfortable. And so a solid orthopedic bed or a bedding that has additional grip or placemats, stationary mats, those are the things that are going to give your dog the most security. It works, they don't have to engage as much core stability trying to walk on these super plush pillows. And they're going to feel so much more comfortable on something that has cushion, but it also has firm elements to it, rather than all those pillows. So that is something I noticed. And then you also mentioned, most of us are wearing shoes, right? Right. If I'm going outside, I've got an issue, I'm going to put on some tennis shoes, some sneakers. Dogs don't wear that, right? So we have to think about what kinds of rugs, mats, yoga mats, rubber is around the house for your elderly dogs or dogs who are just recovering from surgery.
Yeah, and I'm such a huge advocate, as you both know, and some of the listeners know, of ramps. I think it gives independence to these dogs that really need it. I mentioned it early in the exam room. I said, I think that all dogs should be ram trained early on before something happens. And I know not all pet owners have the ability to have a ramp. And this could be not like a humongous one, just enough. Marty Becker and Temple Grandin taught me this at one of the conferences. And one of the biggest fears that dogs have, and cats, pet parents, is the fear of falling. And we're thinking of it as like they have to be high in a high rise, whatnot. It's just falling onto a substrate, whether it be a hardwood floor, just a simple fall like that. They will have such a fear of that hardwood surface. And now you have another anxiety to deal with, the fact that these pet owners don't want to go to your kitchen anymore or go into the bathroom because they fell there. So it just kind of chisels away at the human animal bond a little bit further, and we don't want that to happen. So this is like such a great discussion when we're talking about things that we as veterinarians sometimes fail to recognize as pet parents when we're going over the discharge instructions. Oh, just do this, take those pills, whatnot. But hearing these three different perspectives, I think is so awesome. I love it.
Yeah, I think it goes back to no matter what specialty you're talking about, whether it's dermatology, surgery, medicine, you'll hear us often mention multimodal treatment. And the whole multimodal treatment is that, there's not many diseases where maybe it's the right thing just to be like, here's your one med, the end. For me, often it's things like, okay, well, if you bathe more often, we might be able to use less medications. If we switch your diet to an appropriate one, like we might have a few different things we need, but in the long run, we can lessen the risk of some of these things, because we're utilizing more things in different ways. And I would assume it's the same for you, Courtney, where it's like, okay, obviously we think of the surgery, right? The surgery is great. That's what you're very well trained in. But to your point, you're talking about how important it is to think of the after, that you're on the same page with the pet owner, that they're going to have that restriction. So you don't do this big surgery just for them to jump off, a pickup truck bed like 2 days later and then have a catastrophe happen. And then thinking of where are they laying, do we have a crate we can put them in? So multimodal is really an aspect we can bring in all of veterinary medicine. And we don't say it to be frustrating to the pet owner, because I always empathize with owners like, I have an allergic dog. I get it. Like, I miss her bath. I've missed her flea control. Like, life happens. Life is crazy for all of us. But we're doing our best to see, can we use all of these tools to provide the best care for your pet and be on the same page and be more successful?
100%. The reality is this. The word surgery is one of the only disciplines in which it's both a noun and a verb, right? And so you think about dermatology, ophthalmology, internal medicine, behavior, preventative medicine, and the list goes on. These are all nouns. And so when people come to see the surgery department, they think of an action. They think surgery is going to be performed. And I would say that's probably one of the biggest misconceptions of talking to a surgeon or going to a surgery department, is that they're always going to recommend surgery. right? And so there are times in which the focus is going to be absolutely multimodal, absolutely it may be no surgery, and they're going to contextualize those recommendations based on what's best for your family. And so I completely agree in that you got to find out what's best, and usually what is best is going to be utilizing a variety of different things because let's be honest, it makes sense. The body is so tremendously complex, right? And I mean, even if you just got a snapshot of what the immune system looked like, you'd go, this is the most complicated diagram I've ever seen in my life. And that's just the half of it. And so if you think about it, we've got some outstanding research, outstanding medications, but we are crude in comparison to what Mother Nature and biology has constructed. And so it just makes sense that for a very complicated situation, then you can use a variety of different methods. And so when you look at that diagram, you go, my gosh, it looks so complicated. You know what that says to me? It's an opportunity. Each one of those pathways is an opportunity to show improvement. And that's what makes me, that's what is the most encouraging about all of it.
Yeah, really is. I love it. All right. So as we're wrapping up, Ashley and I have a question for you. We tend to ask a specialist this one. And so, what would be one of the biggest myths that you would want to debunk about being a veterinary surgeon? What's a myth that maybe pet parents may assume or whatnot? Is there something that you can think of that you would want to kind of debunk to the pet parents out there?
Yeah. Okay. So besides the number one, which I think is that if you go to see a veterinary surgeon, they're going to recommend surgery. That's number one. They may not. And then I would say the second is that surgery itself, the process, has to be scary and filled with anxiety. I couldn't disagree more. Certainly, if you are working with a great team, if you're working with doctors you trust and a team that really is engaged with you, then this is not a scary process. It can be a very successful process. It can be finite, meaning you're going to have to focus for a couple weeks, but hopefully it won't be lifelong. And that would be the biggest misconception is that surgery is anxiety driven, scary. Can it be expensive? And times it can, depending on the procedure, but it's worth the emotional and financial investment to at least give it a shot.
I love that you said surgery can be finite because I'm in a specialty that it is not usually finite. But one thing I want to point out, because where I often use surgeons are for ear canal removals. So for pet parents, if you get really horrific ear disease to the point that cartilage of the ear canal becomes calcified, we can't medically reverse that. And so these pets often feel the best after having surgery. But usually I have owners that say, it's just so scary. We're going to remove the ear canal. It's so scary to think about surgery. And I always tell them, just go talk to the surgeon. This is their experience. This is their expertise. But I would say 99% of the time when I send you a case or any surgeon a case that needs that ear canal removed, owners always come back and say, I am so glad I did that. My dog is acting like a puppy again. So surgery can be such a wonderful tool, and almost any specialty may have certain situations that are going to recommend surgery because we have gotten to the point where medical management won't handle it. But to your tune, most of my clients that come in really scared, if you just are open to the surgeon, talk to them about their experience, they come away so relieved after that recovery process has happened because their pet's quality of life has improved dramatically because of the things we couldn't do medically.
Thanks. I would just add to that, you're likely going to have some concerns, right? And this is a shout out to all those pet parents out there. You're likely going to have some concerns. You're likely going to have some anxieties. You're likely going to have some questions, right? If you can, try your hardest to prioritize those first in the conversation. Add those to the top of the list, because let's say you're dealing or you're talking with a busy doctor or a busy surgeon or a busy care team. They're trying to help as many people and families as possible. And if you get involved in a conversation in which you're like, I forgot to ask them that, or I didn't prioritize that, then it can result in you feeling sort of unfulfilled or ungratified. So if you have burning questions, definitely get them at the top of the list. As soon as they jump on the phone, say, hey, I've got a list of questions. I'm going to shoot them at you and just answer them. And that way you get off the conversation or leave the conversation feeling like, okay, I'm feeling a lot better now.
Excellent. Love it. All right. And last question. This is, pet parents, the veterinary community is relatively small, if you don't know. But, it's so nice to kind of find your group of friends that really get you and support you. And the three of us, I know I'm speaking on all three of us right here, that we all get each other. We're here for one another, although we're all different parts of the country. I know that a text or a phone call, they all would be there for each other. So I want to ask you, Dr. Campbell, what is one of the funniest or best memories you have of Dr. Bourgeois? And then what's one of the best memories? Don't screw this up. We rehearsed
I
this.
like how you said you could screw mine up, though. Actually, whatever, but don't screw mine up.
I can't believe you're putting me on the spot like this. I don't know. I mean, I will say it's such a cop-out answer to say all the memories are amazing.
No, it's not. You're not allowed to say that.
I'm not allowed to say that. But I will say, okay, for Dr. Bourgeois, it's a little bit ironic because it's a little bit ironic to be joining her right now on a podcast, because that's the first time that I've ever heard about her. I think I was joining some podcast, maybe shout out to the folks at Clinicians Brief, outstanding podcast there. But I think I believe that she joined a podcast, and as soon as she started speaking, her intelligence, her wit, her grace on the mic, I said, who is this individual? I had to find out who she was. And I immediately realized that she was nothing short of a rock star. And so I would say my favorite memory of her is by far meeting her in person the very first time, because I was like, oh my goodness, there she is. I know people use the term fangirl. I will not use that term for myself, but it's as close as we can get to that. But yeah, I'd say my favorite memory is of her. And by far, I think this goes for everybody, but she's way taller than I thought she was. Way taller.
I remember you saying that when we met in person. I'm 5'9". Yeah. I'm not crazy tall, but taller. And it was funny. You met me and you're like, that voice, you're taller than I expected. That's very sweet. I do remember you being on.
That's exactly what I said.
Yeah, I do remember you being on my podcast, my individual podcast for the veterinary community, pretty early on, and just how wonderful. And I remember you using just a lot of words that I was like, dude, this guy is wicked smart, because he's using words that I do not use in everyday language. But I will say, I thought you were going to say it was the Google Watch bit, because that's like the stupid, funny thing I always think of as like a silly friend thing, where we both are like two of the only people on the planet who don't have iPhones, and we have Google Pixel phones. But then a watch came out, and Courtney barely said anything to me. He was at a surgery conference here in Portland, and he's like, "Did you get the watch?" Like, it was just so stupid, but it was so one of those weird, silly things that then we tease each other, right? We'd be like, "Did you get the watch yet?"
Yeah, I mean, Google Pixel gang unite, man. Google Pixel gang forever, man. And we haven't crossed over to the dark side yet. But I don't know if I ever will. So stay tuned. So far, no iPhone for me. I don't know if you'll ever do that.
But let's hear, don't screw this up now. Let's hear about you. I mean, I can't even imagine what you're going to pick for Adam, because you guys are like at the hip if we go anywhere together.
No, people say that I have an umbilical attachment to Adam Chrisman, but that is not true. The umbilicus is not the body part. No, I'm kidding. I would say that.
You guys keep this PG.
No, I'm totally joking. I was going to say the ear.
I know.
No, I would say that my favorite memory. Adam is definitely the person that I coined the term in my own head. I'm sure it existed way before me, but in my own head, I coined the term meta friend. And a meta friend is this weird friend where you develop a very close friendship over COVID or virtually, and you have never met them in person, right? And so how in the world could you quote unquote be friends and you guys have never even met each other in person or seen each other in the flesh? So when I went to my first conference in Orlando and I saw him, and I think for the very first time, I was like, holy cow, that's freaking Adam Chrisman. My best memory is when somebody asked us, oh my gosh, you guys are such good friends. You guys are such good friends. How long have you known each other? And I said to him, this is my first time meeting him. They were like, no way. I'm like, yeah, this is the very first time. And as you can imagine, the rest is history. So it was just, yes, there's plenty of funny moments. Adam and I have done some crazy things. And like, he's had my freaking like basically an ab workout
Like
because
Chili's.
I'm laughing so hard. Yes, like Chili's, like, I mean, just I could go on and on and on. But if I had to go back from the basics, like get super nostalgic, again, I guess it would be like you, Ash, the very first time I met him in person. It's like the best feeling ever. You know what I mean? So those are my two stories, not necessarily the most hilarious stories, because there are plenty of hilarity that ensued afterwards. But if you're talking about the best feeling, those would be the two best feelings.
I just want to
I'm
preface,
glad-
hold on, real quick, the Chili's. I just want to preface for people listening, like, why in the world are they talking about Chili's? This is one of my favorite memories of me not being present with someone, is that these two were at a conference. And usually Adam's pretty good about, like, if, you know, because we're often all at the same conferences, but we don't all go to all of them. And so Adam usually is like just one of the most wonderful friends to make people feel included. And so he'll usually send a video being like, say hi to Dr. Bourgeois, everyone. And like, he'll send me a video. So he sends me this random video of you two at it, and they're like, look at our fancy dinner. So usually when we go to veterinary conferences, you know, we'll end up at nice restaurants. It'll be fun. You know, we'll catch up. And you two were just on a mandate. And you're like, guess where we are? And it was Chili's. And when I was in high school, Chili's was where we went. I'm all about a Chili's. So I was just dying laughing that is where you two escaped to. So to give some preface, you know, none of us are really that fancy.
Yeah.
We can have a good time at a Chili's or an Applebee's.
Right. We closed it down too, Courtney. I mean, that's how we roll.
We closed it down. We were telling each other stories, laughing. I mean, it's just scandalous stuff. And all at the end where people, only to discover at the end where these people who knew us well, who had been sitting next to us the entire time, were like, oh, we didn't even know you were here. And we were like, oh my gosh, what did they just hear us say for the past 45 minutes, or actually 2 hours, right? So yeah, I would just say it was hilarious. It was amazing. And yeah, I totally unexpected, because this dude is, if anybody doesn't know, he's the most social and inclusive person you'll ever see while he's active. But once he's inactive, you'll never find this guy. So the fact so like, if he goes into hibernation, you'll never
lose my number.
You know?
Yeah. You are a hit or miss.
There we go.
Yeah. But I want to say this to the pet parents and to everybody that tunes in. I love these examples that you're sharing, because I say this so often, that time is so short on this earth. And when somebody says, we got to get together, please get together with them. And this could be, it doesn't have to be a physical get together. It could be what, you know, Ashley and Courtney and all of us are talking about is, we'll make time for a Zoom call just to check in and see how we're doing. And that's the power of a true friendship, if you ask me, because true friends are the ones that will stop what they're doing and make time to see each other and hang out. Again, we're on different areas of the country. I'm not expecting them to fly in to see me, but just at least take 15, 20 minutes out of their month, their week, or whatever. I think it just speaks volumes to what life is really about. In this profession, as many of the pet parents know, it could be draining, it could be challenging. And knowing that we have each other's backs like this, I think is just so powerful. So thank you really for your friendship to both of you. I love you both very, very much, as you know.
Yeah. And that's part of the reason we're doing the podcast, as an excuse to hang out with our friends virtually. So
right. Save me a copay.
So Dr. Campbell, Courtney Campbell, you made it. You made it through our podcast, and we are so grateful. Thank you so much for just opening up in the dance moves, Adam. Thank you so much for just opening up about veterinary surgery, about your experience as a veterinarian. I hope it's something that all pet parents can really just have some fun with, but also gain some really comfort with, knowing that at the end of the day, all of us are here for you guys. So thank you so much for being on Sit, Stay, Laugh, Courtney.
Dr. Campbell.
This was an amazing experience, and I hope we get to do a round two. Thank you so much for your friendship and outstanding work on this podcast. I can't wait to hear this episode.